Good afternoon, and thank you for inviting me to speak today. By way of some background, I am a clinical psychologist at Nationwide Children's Hospital, where I work primarily with children who have congenital conditions such as cleft lip and palate and other more rare genetic conditions. My connection to the CDG community is personal in that my daughter Marion had ALG1 CDG. Today I'm going to describe the psychosocial impact of CDG for both families and affected individuals. I will draw on the limited rare disease literature and more extensive pediatric psychology literature about the psychosocial impact of complex conditions like CDG. I will also briefly discuss some treatment approaches and resources, as well as strategies to promote healthy coping and resilience. As a caveat, given the diversity that is inherent to CDG regarding type, severity, and impact on physical and cognitive abilities, the issues discussed may not apply to all persons with CDG or their families. I have attempted to highlight common concerns as reported in the literature and by families themselves. CDG is characterized by marked variability in both the type and severity of its physical and behavioral manifestations across subtypes, as well as both within and across individuals. Even if a child, adolescent, or adult has only mild symptoms across body systems, the cumulative effect of the condition can still be substantial on both physical and mental health, and relatedly, its impact on the family. It is important to understand the psychosocial impacts associated with CDG in order to maximize the likelihood of achieving healthy psychosocial outcomes and good quality of life for affected individuals and their families, and importantly, to provide anticipatory guidance and referrals to behavioral health treatment if indicated. I'm going to start today by talking about the psychosocial impact on the family. It is an exceedingly stressful experience to have your child diagnosed with a rare and potentially life-threatening condition, such as CDG. Feelings of grief and loss are common, along with feelings of confusion, anger, guilt, anxiety, and sadness. These are normal reactions to highly unusual life events. Each parent and family member may experience these feelings at different times, but they are quite common around the time a diagnosis is received. Most families are able to regroup and adjust to their child's condition, but this takes time and is often an unpredictable process. With CDG, particularly in the early years, it can feel like there's one medical crisis after another. There will likely be times when families feel like they can manage their child's needs, while at other times they may feel overwhelmed. Additionally, families have to learn to navigate the healthcare system, which is often a new and different culture. For example, figuring out which specialists manage which problems and dealing with insurance coverage. When thinking about psychosocial impacts on the family, it is important to keep in mind that CDG-related challenges will vary depending on the developmental stage of the child, the type and severity of the condition and related interventions, and family resources and stressors. For example, patients and families may experience more stress and burden of care depending on the number of interventions or procedures required to manage their child's health and related complications. And pre-existing stressors like unemployment or family problems like marital difficulties can also contribute to how well a family adapts to their child's diagnosis. While recent advances in genetic testing and growing awareness of CDG are enabling more families to find out about their child's diagnosis sooner, many still face an odyssey of tests and evaluations and visits with countless specialists before getting an answer. And then, of course, there's the challenge of even saying congenital disorder of glycosylation, let alone trying to understand or explain the complexity of the condition. Because CDG is rare, it can be hard for parents to find accurate information about the disorder and its management. It can also be challenging to find appropriate care since many doctors may be unfamiliar with the disease. Parents may find themselves in the uncomfortable position of being more knowledgeable at times than some physicians about the disorder, or needing to travel for healthcare, which can pose financial and other burdens. Additionally, the uncertainty associated with not knowing what is wrong with your child, followed by knowing what is wrong, but learning that there is no cure and no clear way to predict your child's prognosis or outcome, can be great sources of stress and worry for parents. One of the greatest challenges that families affected by rare conditions can face is isolation. Knowing that your child is one of 1,000 or even fewer in the world with a condition can make you feel pretty alone. Unlike common pediatric conditions, it can be hard to find other families who know what you are going through or who have walked this path and can offer practical tips and advice. Family and friends may not know how to help or say things that are not helpful, which can contribute to feelings of isolation. Financial strain is also common. Traveling for medical care, repeated hospitalizations, prescriptions, in-home nursing, developmental therapies, assistive devices can all be incredibly expensive, even with insurance coverage. Parents may also experience disruptions in their abilities to work when caring for their child or have difficulty finding childcare so that they can continue to work, which can add to financial burdens. Children who have mobility problems may need assistive devices and wheelchair-accessible homes and cars, which can be additional expenses. Rare conditions can also potentially make it more difficult for families to access services. Insurance companies and community and governmental agencies may not be familiar with the disease or its ramifications, which means families may have to jump through additional hoops in order to document their child's needs. Not surprisingly, the cumulative effects of CDG-related stressors can lead to psychosocial difficulties. Parents caregiving for a child can experience strain on their relationships. Siblings can also experience impacts. They may feel lost in the shuffle or that their needs are not as important. Friends and extended family members may not know how to help, and parents sometimes may find that they have less in common with old friends and even extended family who can't relate to their situation. Isolation, uncertainty, financial strain, and the chronic worry about their child's health can contribute to the development of mental health problems, including anxiety or depression. Finally, there is evidence that chronic stressors, including caregiving for a child with special healthcare needs, can lead to physical health problems for parents, as stress is known to reduce immune system function. As I mentioned briefly, siblings can also be affected. Studies have shown that siblings of children with both more common and rare conditions are at greater risk for internalizing and externalizing problems, for example, depression, anxiety, or acting out behaviors. This may be due to the fact that siblings are exposed to potentially traumatizing aspects of their brother or sister's medical condition and related care, such as a prolonged hospital stay in the pediatric intensive care unit. Siblings may experience differential treatment from parents or be expected to take on responsibilities at a younger age, which may affect their adjustment. They may answer questions or perceptions about their siblings' condition. Sometimes siblings can feel from peers or even be teased or bullied because of their brother or sister's differences. They may also minimize their feelings and concerns so that they won't cause more distress for their parents. Children, adolescents, and adults with CDG are also at risk for behavioral health concerns. In the broader literature, there's evidence that children with chronic health conditions are at greater risk for psychological problems relative to physically healthy children. Similarly, if we look at the literature about psychosocial functioning in persons with developmental and/or intellectual disabilities, approximately a third will meet criteria for a psychiatric disorder like anxiety or depression. Children with CDG are at risk for developmental delays, often in multiple domains, as well as intellectual disabilities, which are defined as having a full-scale IQ below 70 with low adaptive and daily living skills. Seizures are often common in some types of CDG and may also impact risks for cognitive and behavioral problems. The literature on psychological functioning and outcomes in children with CDG is pretty sparse beyond case descriptions. One study of 18 children with CDG, specifically PMM2 CDG, used a common psychological measure called the Child Behavior Checklist. Results indicated that children with CDG were at increased risk for social problems, depressed or withdrawn behavior, and somatic complaints. 72% scored in the clinical range on this instrument, meaning that their symptoms warranted psychological and/or psychiatric treatment. Similarly, Dr. Mareva and her colleagues also reported on behavioral problems in 41 individuals with ALG6 CDG. 34% reported behavioral concerns, including autism symptoms, mood changes, aggressive behaviors, particularly around puberty, sleep disturbances, and other repetitive behaviors. Families of children, adolescents, and adults with CDG often report concerns about sleep, mood, anxiety, as well as agitation and aggression. Sleep disturbances can include early waking times, difficulties falling asleep or insomnia, or problems staying asleep. Sleep problems can affect daytime functioning, resulting in decreased alertness, irritability, and problems with cognition, including concentration and memory. It can also be a significant source of stress and sleep deprivation for other family members, especially parents. Consistent with the limited reports in the literature about CDG, concerns about mood, including depression and mood changes, have also been anecdotally reported by parents and other family members. Depression is characterized by sad, tearful, irritable, or angry moods, often that are persistent, loss of interest or apathy, particularly in activities or interests that used to bring pleasure, sleep, appetite disturbances, either increases or decreases, as well as poor concentration. Anxiety is another common concern and is characterized by intense worries or fears, avoidance of activities or refusal to complete certain tasks. Again, there can be poor concentration, physical symptoms such as headaches or stomach aches or other aches and pains, difficulty sleeping, and anger or irritability. Agitation, including disruptive behaviors in response to limit setting or other belligerent or uncooperative behaviors, have also been reported by parents of individuals with CDG. Sometimes agitation can be an indicator of other psychiatric disorders, for example, ADHD or mood or anxiety disorders. You can also see agitation if an individual is struggling to cope with academic or social situations that are too challenging or inappropriate for their developmental age or stage. Similarly, aggressive behaviors like hitting or biting others or oneself have also been anecdotally reported by families of children, adolescents, and adults with CDG. These behaviors are often responses to situational stressors as opposed to being planned or intentional, and may reflect maladaptive responses to frustration or stress. Pain, inability to understand something that's happening in their environment, or underlying medical or psychiatric disorders could also be triggers for aggression. Another important issue to mention is that there can be a tendency when children, adolescents, or adults have an underlying rare disease to attribute behavioral problems to the individual's underlying medical condition or to their developmental disability. This is a phenomenon that's called diagnostic overshadowing, and that means that sometimes symptoms of behavioral health problems may go unrecognized and untreated. So it's important that evaluations and or treatment for behavioral or psychiatric concerns are conducted if a child's behavior or challenges are causing significant distress or negatively impacting his or her daily functioning or the family's functioning. Some clues that a child or adolescent or adult with CDG may have an underlying behavioral health or psychiatric disorder warranting further evaluation and treatment include recent onset of the behavioral concern. Is this a new behavior or a change in mood or behavior that is persisting? An exacerbation or worsening of baseline behaviors or functioning? Have you attempted to change the environment, for example, increasing sleep or changing routines, but with no success? Also, if you're observing behavior changes across environments, so for example, seeing the same changes at home and at school, that may be a clue that there's an underlying problem warranting further evaluation. Similarly, if you're noticing changes in sleep, appetite, interest level, or agitation, then it's important to consider that there could be an underlying psychiatric disorder warranting further evaluation and or treatment. Given these risks and the fact that symptoms can overlap across psychiatric disorders, available guidelines for PMM2 CDG recommend cognitive and or developmental assessments over time. Often these evaluations will include some assessment of behavioral and or social functioning, along with psychiatric evaluations as needed. As more research and clinical data emerge, it may be beneficial to recommend more frequent assessment of behavioral health risks in CDG. In terms of assessment and treatment, it is important to take an interdisciplinary approach. meaning that there should be collaboration between behavioral health providers like psychiatrists and psychologists and the individual's medical specialists. It's critical to rule out physical problems that could be responsible for symptoms and then to proceed with a psychological and/or psychiatric evaluation. Often, behavior therapy is the first line of approach to addressing psychiatric problems, although for anxiety, mood, and some other behavioral disorders, a combination of medication and therapy may be most effective. And in some circumstances, a trial with medication may be most appropriate, particularly if there are concerns about an individual's ability to participate in therapy. Effective treatment typically begins with a comprehensive assessment that ideally will involve information from parents, caregivers, teachers, and the child, him or herself, if age and developmentally appropriate. This will typically involve what we call a functional analysis of ABCs. And by ABCs, we mean antecedents. So what's happening before or triggers behaviors that are problematic. A really detailed assessment of the behavior, when, where is it occurring, frequency and duration, as well as consequences. What happens after a behavior occurs? That will often give you a clue as potentially to its function, as well as maybe some factors that are inadvertently reinforcing the behavior, meaning that it's more likely to happen again. For psychological treatments, behavior therapy or cognitive behavioral therapy are evidence-based approaches to treating concerns like sleep problems, anxiety, and depression. Mental health professionals who provide behavioral or cognitive behavioral therapy include doctoral level psychologists who are typically more likely to have been trained in these types of therapies, but can also include social workers, counselors, and other individuals with typically master's degrees in a mental health field. Additionally, particularly for children, adolescents, or adults with intellectual developmental disabilities or who are nonverbal, applied behavioral analysis is a specific type of therapy that may be helpful in terms of addressing problematic behaviors. Another kind of piece of advice I typically provide when considering treatment for any type of behavioral concern is that you spend some time interviewing the potential provider and ask them specifically about their approach. How do they treat behavioral disorders? How long do you expect that therapy could last? And then importantly, to make sure that the individual is licensed or certified by their state. And typically, most providers are happy to answer questions. If they're not, that can be a red flag that maybe you want to interview somebody else before initiating treatment. If medication is a consideration, typically psychiatrists or developmental pediatricians will be the providers who can oversee medication management for any type of psychiatric or behavioral concern. Psychiatrists are trained as physicians with additional residency and are trained as physicians with additional residency training in psychiatry after they complete medical school. So these are typically MDs, sometimes DOs. Some psychiatrists can provide both therapy and medication, but many only provide medication consultation and management. Developmental pediatricians also have expertise in developmental and behavioral problems. They often work with children who have intellectual or developmental disabilities or known developmental delays. So they can prescribe and monitor medications as well. And it's important to remember that an important distinction between mental health providers is that psychiatrists and developmental pediatricians can prescribe medications, whereas psychologists, counselors, therapists, social workers typically cannot. There are a few exceptions across the United States, but typically they are not going to be able to prescribe medication. In addition to seeking treatment, either psychological therapy or medication, when indicated, there are some other ways that you can enhance resiliency and support coping within the context of your family. Often in the face of challenges, we can thrive and become stronger. We learn something about ourselves. We may find that we have grown in some respect as a result of our struggles. Many people who have experienced challenges related to having chronic conditions have reported better relationships, greater sense of strength, even when feeling vulnerable. increased senses of self-worth, and a more developed spirituality and heightened appreciation for life and what's really important. Some even find that despite their own challenges, they're able to give back and help others through sharing their own stories. So what are some ways that families can stay healthy despite the strain of caring for a child with a rare condition? I'll just discuss a few strategies that can be helpful, including seeking out information and support, engaging in self-care, maintaining healthy family interactions and activities, and keeping a healthy perspective. Information about CDG is key, particularly in this era when research is expanding and new developments are rapidly occurring. Because of dedicated families like yourselves and researchers, clinicians, and advocates, there is growing awareness and access to both information and support for families affected by CDG across the globe. Thanks to social media and the internet, these resources are more easily accessed, and can be a tremendous source of support, not only for disease-related information, but for families to connect, share their stories, and share practical tips and strategies for managing various problems. The support offered by these groups cannot be underestimated when your child has a rare disease. These resources will continue to help promote awareness, which in turn will help support research and better care for affected children and their families. Connecting with other parents can help alleviate isolation and empower newly diagnosed families. Your story is important, and its impact may be life-changing for another family. Research also suggests that parents who have more social support tend to experience fewer problems adjusting to their child's condition and the challenges that they face. It's good to have both in real life and online connections. Support can mean not just having someone to talk with about your concerns and worries, but also help with practical issues. So think about ways that family and friends can offer practical support, whether it's making a meal or providing some childcare while you run an errand. It can also be helpful to talk with a counselor or psychologist. Having someone who is outside of your family who can offer an objective perspective can be a great way to get support and just to have some time for your own emotional processing and to sort of give back to yourself. I'd also like to highlight that one potential positive of the recent pandemic is that more therapy is now available via telemedicine. So hopefully that will alleviate some of the traditional barriers that sometimes families face when trying to secure mental health treatment for themselves. As parents, it's easy to put our own needs on the back burner, and this is even more true when a child has a chronic medical condition. Without self-care, physical and mental health problems can arise and may cause even more stress and difficulties for the family. It is critical to carve out even small bits of time to rest and recharge on a regular basis. Parents often find that they are better equipped to handle stress when they are taking care of themselves. Chronic medical conditions can affect the roles and relationships within the family. It is key to communicate with each other and to talk openly about feelings, both positive and negative. It's also good to take time out for fun and normalcy, away from medical visits and hospital stays. For siblings, prioritizing one-on-one time with them and being mindful of their roles and responsibilities can be important. They are children with needs too, albeit different ones. CDG presents many unpredictable challenges, but you can maintain control over your own perspective. Thoughts or beliefs about situations and events are closely linked to our feelings. Negative feelings are associated with negative thoughts and beliefs. Remind yourself to look at both sides of a situation or a problem. Is there any potential for something good to come out of this? If not now, maybe later. It can also help to focus on what you can control and manage today rather than worrying months or years ahead. It can be helpful to do some perspective taking, reminding yourself about how you've successfully coped with other tough situations in the past. Finally, thinking about how you may be able to share your experiences to help others can also be a useful strategy. For families that may be experiencing difficulties adjusting and coping with their child's condition, here's a list of resources that can potentially help you find professional support in your area. I also encourage you to reach out to pediatricians and primary care physicians for referrals. I'd like to thank you for your attention, and I'm happy to address any questions.